Huma Qureshi, welcome to NDTV. Good to see you.
Good to see you. Thank you so much for doing this. Thanks, Rohit.
Not at all. My pleasure. First question to whoever I interview nowadays is, how are you? How is your family? How are your friends?
We're good. We're good. We're home. My parents are here. My dad had a bit of a health scare in Jan, so I got both my parents, to be here with me in Mumbai, and I'm so glad. Otherwise, I would have been so distraught and worrying about them. So yeah, all of us are home and sheltered and thankfully safe for now. Yes. Thank you.
That's the best thing that, when you say, Uma, you asked your parents to come here, do you feel right now at the point where we are, Mumbai is fairly a safe place to be in, right?
100%. I think full credit goes to the government, the BMC. They've done an exceptional job. I mean, I know this because I know a lot of my friends and people around me and staff members and colleagues, who were sick, and we all, got really worried. And I think there was a time about 2 or 3 weeks ago where things was really sort of looking like they were getting out of hand. But I have to say, I think 900 cases now as of yesterday, which is incredible. And I have to say the whole credit goes to BMC, the frontline health workers, the doctors, the nurses. They all have done an exceptional job. I mean, I cannot thank them enough for their hard work, for their dedication to what they're doing. And really, I hope that as far as the second wave is concerned, the worst is behind us. But of course, one can't take this lightly. I think that's one lesson to learn from this, that one cannot think and sit back and be like, okay, you know what, we can just get back to living our normal lives and be relaxed. I think we have to be more careful than ever till all of us are vaccinated, till the numbers come down completely, till it is safe for us to move around and about without masks. I think everyone has to be extremely, extremely careful and not take this lightly anymore.
Right, that's really important. That's an important message to everyone. At a time like this, we saw a lot of citizens, individuals come out. We saw a lot from you yourself, your fraternity members come out, tweet, get people oxygen, beds. What did you think kicked this off, where people took it on themselves that, okay, let's just do whatever little bit we can?
We were just all horrified, yeah. We were just pained and horrified, and we could not believe, this was happening to us. I know my best friend was sick and he was in the ICU for a few days, and I remember like how helpless we all felt and how scared we all felt. And I think that sort of started this whole, understanding and educating myself also, and trying to understand why is it happening, what can we do. And similarly, I see it with all my colleagues and friends, even from the fraternity. I think this pandemic has shown us the worst that it is. And we've seen all the horrific visuals of people crying and not getting beds, and, literally people dying outside hospital gates. And that has really sort of moved all of us. But also, I have to see this in the same breath that I've also seen the best in human beings. I've seen citizens standing up for each other and being like, okay, you know what, this is time for us to get up, and whether it's our time, our energy, our money, we will get up and we'll make a difference. And I think that gives me a lot of hope in India, in humanity, in all of us. I think there's been such a massive outpouring of support from everywhere. Just people getting up and being like, okay, you know what, nothing else matters. Let's try and get out of the situation. Let's try and help each other, one human being to another.
Right. This is another side of social media that we completely saw till a time it was used for business. It was used for, people used it for trolling you guys, celebrities. And now we've seen how all you people are using this to actually help whoever you can.
Yeah, my parents always say this, everything is a double-edged sword. Even freedom, even love, everything is. So it depends on how you use it. And sure, social media has got a lot of bad rep in the past about being negative, about trolling, about all of that. And sure, that is a side that exists. But I think this time around, one has really seen, when people were stranded. I myself have, gotten on a few weeks ago, managed to get somebody a hospital bed in Agra, connected another doctor to a patient, in like Chennai. So I feel like all of us have used this and tried to, use this for the betterment of other people, as opposed to just using it to just vent, And like, I know my brother Saqib, like he was helping a lady who was pregnant in Bangalore, and we didn't know anyone in Bangalore, and how after being rejected from more than 40 hospitals, finally Rainbow Hospital in Bangalore, took her in, and she was able to give birth to a healthy baby boy.
Oh, wow. That's
That was an incredible thing. And if even once something like that happens in a day, it makes you feel कि आज मैंने कुछ किया. आज मैं खाली घर बैठ के खाली टीवी नहीं देखा, मैंने कुछ अपने लाइफ के साथ किसी की जिंदगी में little bit of a difference I was able to make, and that feeling is unmatched. That feeling is crazy.
Right. While you're talking about this, your good friend Sonakshi Sinha is here, I'm told. So let's have her as well.
Hi. I couldn't wait. Sorry, I was ready and I was like, I'm joining this interview.
We are very
barging in.
Before you come in, I have to give a little introduction. Rohit, I have to tell you this. Sonakshi has been such a trooper, and she has been one of the first people who has joined this campaign. She has donated generously. She has helped us spread the word, and she has done this without any amount of vanity or self. I mean, it's just been so incredible how she has just come forth as a warrior for this. I mean, thank you, Sona. Like, I've never said this to you in as many words, but you have been incredible.
You don't even have to. I think I'm just so proud of her proud of her just for starting this initiative. And when it's someone who you're so close to and is honest and genuine and generous and loving and kind and giving, and when a person like that does something like this, you have no choice but to help out and be a part of it. I'm so glad that she's taken up this initiative, and I know that the funds are going to, the right people, the right places, and going for the best cause possible at this point of time. And, sitting at home, this is the least that we can do. Yeah. I've been trying to encourage people to donate as much as they can as well, because I myself am feeling so helpless. We're not able to go out. We've been told that the best thing that you can do to help out our healthcare workers and all is to stay at home and stop the spread of the virus. So sitting at home, this is what we can do. And I'm so proud of Huma for doing this,
Right. Thank you. I can just feel this positivity and, this truly making a difference. So from what she said, Huma, can you tell the viewers who are watching right now, what is this? Where can they log on? How can they help? Where can they donate?
Well, all the information, of course, is on the Save the Children page. We have 2 donation links, one for the Indian donors and one for international donors. So, I mean, and we keep saying this, no donation is too big or too small. Already in about 8-9 days, we have collected about 70 lakhs, which is a massive amount. When we started this whole thing, I remember talking to
someone. I mean, imagine if every person donated even 1 rupee, we'd have like 1 billion rupees. So, exactly. I mean, that's how far even a small donation can go, So, no amount is too small or too big.
Exactly. And I think that's the whole vibe we're going with. We're telling people don't feel like, and people have, I was so surprised. My social media team, suddenly I'm seeing they've donated like whatever they could, like $500. And I was like, guys, they're like, no, of course, but we're seeing how each rupee, every single rupee makes a big difference, and how even 5,000 rupees can save somebody's life.
Right.
Even 8,000 rupees, and we actually literally sat down, we broke down. Like for $8,000, you can be at home. You can get a doctor to talk to you. You can get the medicines. All those home care kits that the Save the Children team have designed can actually help you stay at home and get better. Absolutely. Isn't that incredible? For 30,000 rupees, you can give somebody an oxygen bed and a hospital bed. Like
incredible.
That's, I mean, and I know so many people were like, okay, you know what? मेरे 10 bed book कर दो. मतलब मैं 10 लोगों का तो hospital bed दिला ही सकता हूँ ना. So that's been the vibe.
That's great that you have started. Sonakshi, in fact, this is a lot of people clearly want to donate, but they just want to make sure it goes to the right places. Is that always your concern as well?
Yeah, definitely. Because, you're hearing so many horror stories about people producing fake medicines. In fact, one of our friends, Huma and my friends, was in the hospital, and, just to get the remdesivir injections for him was literally like a task. You had to make so many calls and make sure that the doctors at the hospital were giving it to him. What was meant for him did go to him. So it's really, you're hearing these stories. So obviously everybody has that concern where, you want it to go to the right source and the right people. So which is why even when whatever I can use my social media for, I've been verifying through my team, verifying the sources, verifying the hospitals, the organizations that are genuinely working towards, fighting this pandemic, and just because our word does make a difference to people,
Right,
you know,
right.
they listen to us. So I feel that if you can't use your voice for the good, there's no point of having a voice at all. So
Right.
that's what even I've been trying from my end, you know, just to verify the sources and make sure that, you know, people know about these organizations who are actually going out there and doing the best job that they can.
Right. I
I
asked this to
remember
Huma
one
as
point
well. Yeah.
Sonakshi's social media was completely taken over by all the different organizations, and she was literally sitting down and making a list, being like, okay, donate to this one. These are good people. They're sending off.
Yeah. I mean, we really need just good people to, you know, make sure that, you know, the work is being carried out. And I'm really thankful to my team also, my PR team, who really like put together these organizations and just compiled a list, and I've just put it out there for everyone.
Amazing. I asked this to Huma as well. So actually, is this a new side of social media? You've had all kind of brushes with social media over the years. This is how it should be used?
This is also how it can be used. I think each to his own. But like I said, you know, if you don't use your voice for the right reasons and for the good of the world, I don't think there's a point in having it. So as of now, I think it's the need of the hour.
Right.
And as many people as we can reach out to, you know, we can do it through our social media. So it's the best use of it right now is to help out people.
Huma, what is the target and, you know, what did you start with? What did you think you'll achieve and how far you've come? Are you happy with so far?
We're close to the 50% mark, which is
Okay.
great. Actually, at this point, I also want to, I want to bring Jatin in. Jatin is our on-ground person.
We're waiting to him to join. Yeah.
Whenever. So we've hit the 50% mark, which is incredible, and work is already started. We've identified a location in Delhi at the Tilak Nagar Hospital. We're working very closely with the municipality and the government over there. Mm-hmm. And already as of today, 70 oxygen concentrators have reached the location. In fact, in a few minutes after this interview, I'm going to put all those pictures of those oxygen cylinders reaching that facility. So that's an incredible thing. We're also planning to start a childcare and a pediatric unit in that particular hospital, because so many stories, like now, as we all know, numbers are coming down, right? Mm-hmm. But the important thing for us is to, of course, build the infrastructure in place, and also to ensure that whenever, God forbid, this third wave comes, we are better prepared and it doesn't hit us like out of nowhere. And especially so many cases of women who were stranded, who, you know, needed a place to go and deliver babies, or just post early child care. You know, all these things are coming forward. And I'm going to say like this, so many individuals like Sonakshi have come forward and have donated so generously. It's really been heartening. And I know she has, and so many other people have donated to multiple organizations. Right. So it's not just, I mean, this is just, I'm aware of what she's doing. I know there's so much else that she's doing.
Right.
Apart from that, organization has come forward. So I know we're talking to somebody who've come forward and saying, you know what, we're going to give you 5 ventilators.
Right.
So, you know, you can set up a ventilator service, or, you know, in the hospital as well, because I know what's happening.
Right.
The situation on ground is so dynamic and it keeps changing. Every day you know about, okay, this is needed, that is needed. And we're just trying to do the best that we can do. I mean, of course, Jatin is on ground.
Jatin is right here. Jatin is right here. Let's get Jatin and just let him share some details with us. That's an incredible work. We are all so proud from what Huma told us and what Sonakshi told us. You know, you have to keep up this absolutely incredible work. But our viewers would like to know when someone like Huma comes on board, when someone like Sonakshi comes out and spreads the word, you know, how much does it escalate and how does it help?
It really helps. And let me begin by actually thanking Huma and Sonakshi and many others who are with Huma in this campaign. A big shout out and big thank you to all of you. See, the COVID in the first wave, it was an unprecedented thing. We didn't know how to cope. We were grappling, but slowly we have learned. We have learned a lot. And we have been doing things more or less in our own ways. So one of the learning and after the second wave was, unless we collaborate, unless we join our forces, unless we join strength with the government, with corporates, with influencers, with celebrities, this cannot be fought. So this is the spirit with which we are collaborating, and the response is tremendous. We are able to, you know, penetrate more into the areas where hard to reach areas where children are the most vulnerable. You know, so there is a degree of vulnerability and children in the hard to reach areas are most vulnerable, even sometimes in the heart of the cities in the slum pockets. So that's where we are able to reach with this collaboration. So this is really important. Yeah.
So this campaign that has started and there's a target amount for it. Could you tell the viewers, Jatin, if you don't mind, how will this be used? Where will be, that is always the concern, and it's great that you are a part of it. So there's a lot of trust already there, but where will this be used and how will this be used?
Yes. So as Save the Children, we work to protect the rights of children. One of the major right is the right to survival, and which is in question. So now with this amount that will be raised, we will be working to protect children who are, in the likelihood of becoming vulnerable to this COVID situation. We will be, reaching out to their families, talking to them, linking them with these facilities. So when I say facility, right now with Huma and with the campaign, we are working on a 100-bedded facility in Delhi, in Tilak Nagar, the hospital. The work has already started. Today, this morning, about 70 concentrators, oxygen concentrators, reached the hospital.
Wow.
And this is a 100-bedded facility, plus Huma has also kindly agreed to support us to set up a pediatric and a neonatal ICU within this facility. So I can't even explain in words how far this will go in, saving lives.
Right. Thank you, Jatin, for everything that you're doing. Before I come to Huma and end this, Sonakshi, I really, what we are doing is, you're doing this from last year. If you can give out a message to people to continue to wear a mask, double mask, or whatever you want to add, go get vaccinated if you're eligible.
Yes, absolutely. I think that's the least we can do, just to take off the load of our healthcare workers and the professionals who are working day in and day out. Just get vaccinated, book your slot, go whenever you get the chance, whenever the vaccines are available, please make sure you go and get vaccinated. But of course, even when you're done getting your vaccine, don't leave the COVID appropriate behaviors, which is wearing a mask, washing your hands, sanitizing, all of that, because you could still be a carrier. Even though you might be less susceptible to the symptoms of, the severe symptoms of COVID. So yeah, please, we're all in this together, everyone. Let's make sure we're doing the best we can. And yeah, that's what I'd like to say for now. I said a lot, but.
Right. Well, you have to tell us two things. One is a message for people just to, be safe. And also, before we wrap, where can they come out and donate and help this amazing initiative?
Well, first of all, I want to thank 3 people in this chat with me. Rohit, thank you for doing this and for spreading this message far and wide. It's really, really incredible. Jatin, for all the on-ground work and your experience and your knowledge that you bring. I have learned so much from you. I've never said this to you in as many words, but I want to say it now. And I know we will do this. And whenever I have been lost or scared, I talk to you and you tell me, ho jayega, karenge, one step at a time. Because, you've obviously done so many interventions on ground. So thank you for showing me how it's being done. And of course, Sonakshi, she's, guys, really a girl with a golden heart. I am so blessed to know you as my friend and a champion. Every girl needs a Sona in her corner. So thank you for doing this. Thank you for being so kind and so generous. I cannot, words fail me, at this point in time. So I'm just saying that we have such a good thing going, guys. Whoever's watching this, please go out, please donate. Go to the Save the Children page. Go to the Give India page for all international donations. My Instagram has all the information. You will be seeing in the next week what we're doing on ground in terms of building this facility, literally step by step. We all have been talking कि we are not going to wait कि सारा पैसा आ जाएगा फिर हम काम शुरू करेंगे. We are going to do it phase wise. We're going to try and make as much of a difference to people on ground as possible. And we need all the help that we can get. We can't do this alone. It has to be a collective citizens' effort. It has to be all of us.
Great. Thank you for doing this. Thank you, Huma. Thank you, Sonakshi. Thank you, Jatin.
Thank you, Rohit.
Guys,
Always a pleasure talking to you guys. Thank you so much.